Hi everyone, in this video, I will do the return demonstration of Leopold's maneuver. So, let's start. Leopold's maneuver is the standard palpation of the abdomen for assessing the fetus position, presentation, and degree of descent. The main purposes of Leopold's maneuver are: first, is to determine the number of fetus; second, is to identify the fetus position, presentation, degree of descent, and attitude of the fetus. And lastly, is to identify the point maximum intensity of fetal heart tone in relation to women's abdomen. The equipment needed for this procedure are: first, the pillow; second, the tape measure to measure the fundic height; and lastly, the stethoscope to locate the fetal heartbeat. First, check the client's chart. Read the doctor's order of the said procedure and check client's condition and restriction. This to ensure that you're administering the procedure to the right client. Second, do client assessment. Obtains obstetrical history including parity, gravidity score, LMP, EDC, and AOG or fundic height. This together data would make computation accurate. Also, take the vital signs. This to baseline data prior to doing the procedure for comparison purposes.
Ay ma'am, napay questions sa imo ha, if okay lang. So, kana sa imong last menstruation period ma'am? Kapila na ka nabuntis ma'am? Kapila na ka nakaanak ma'am? Ma'am, ibutang na ako ha, mag-measure na ko. Ma'am, magkuha ko vital sign nimo, so pwede na ako magkuha ng kamot ma'am.
Next, explain the procedure to the client. To elicit cooperation of the client, it reduces apprehension and encourages cooperation.
Hi ma'am, may buntag. Ako dahil si Tricia Salso, student nurse from the University of Mindanao. So, unsay pangalan mo ma'am? Kamusta ka ma'am? So, pwede rin kumapan ma'am, karamatan mo kamot. Thank you ma'am. So, karon day ma'am is na ako i-perform, which is mga siyang Leopold's maneuver. So, ang Leopold's maneuver ma'am is akong ipalpate imong tiyan para mag-locate nato kung unsa ang position ug ang presentation sa imong baby ma'am.
Fourth, instruct the client to empty her bladder before performing the procedure. This to avoid discomfort to the client and provide relaxation during the procedure.
Ma'am, kanang before na to buhaton ang procedure, kanang i-empty sa nimo imong bladder ma'am. So, kung kaya nimo ma'am or magpa-assist ka sa kuha na kanang mo sa CR.
Next, gather the needed equipment and check for its completeness. To be organized promotes efficient time management. And next, do hand washing prior to the procedure. This to do hand washing deters the spread of pathogens. And lastly, provide for client privacy. This to ensure cooperation of the client during the procedure. Place the woman in dorsal recumbent position or supine with knees flexed to relax abdominal muscle. Drape the client using the top blanket, exposing only the abdomen, and place a pillow under her head. This to have easy access during the maneuver to make client more comfortable and gain cooperation.
Ma'am, mahiga sa tama mga gusto kay assist ka or dili na ma'am. Di ma'am, hinahinay ta ma'am. Okay ka ma'am? Magbutang ko gunan ma'am ha, taasan ako mong ulo.
Next, make sure that the hands are warm before coming in contact with the client's abdomen. Rub the hands together vigorously to prevent uterine contractions and use the palm of the hand instead of the fingers. This to prevent startling of the client and to produce warmth. First maneuver or fundal grip. Using both hands and facing the client, feel for the fetal part lying in the fundus, determining the shape, size, mobility, and consistency of what is palpated. This to avoid overreaching of the client's abdomen, able to palpate the fundus and feel the parts lying under. Findings: head is more firm, hard and round that moves independently of the body, while the bridge is less well-defined that moves only in a conjunction with the body. Second maneuver or the umbilical grip. One hand is used to steady the uterus on one side of the abdomen while the other hand moves slightly on a circular motion from top to the lower segment of the uterus to feel the fetal back and small fetal parts. Use gently but deep pressure. Repeat this step on the opposite side using the opposite hand. Findings: fetal back is smooth, hard, and resistant surface. However, knees and elbows of fetus fill with a number of angular modulation. This to use both hands in palpated aid in correct findings during the second maneuver. Next is the third maneuver or Pollock's grip. Using thumb and fingers, grabs the lower portion of the abdomen above symphysis pubis. Press in slightly and make gently movements from side to side. Findings: the presenting part is not engaged if it is not movable. However, it is not yet engaged if it is movable. This, engaged or not engaged yet. Fourth maneuver or pelvic grip. Facing fourth part of the woman, palpate fetal head pressing downward about 2 inches above the inguinal ligament. Use both hands. Findings: good attitude if brows correspond to the side that contain the elbows and knees. However, poor attitude if examining fingers will meet an obstruction on the same side as fetal back. Next, place the client to its proper and comfortable position. This to make clients relax after the procedure. And do hand washing. This to reduce transmission of microorganisms. Document the procedure and assessment during the care. This careful record is important for documentation after client care. Reporting and recording of information about the procedure must be accurate and timely for continuity of care. Thank you for watching. I hope you learned something from this video. God bless us all.